A wildfire burning near Flin Flon blanketed much of the province in heavy smoke this weekend, triggering air quality warnings. While those warnings have now been lifted in many areas, wildfire smoke can be harmful to our health, even at very low levels. And joining me now to talk more about that is Chris Pascoe from the Airsafe Lab at the University of Manitoba, where the effects of air pollution on our health are actively being studied. Chris, thanks for joining us.
Thank you for having me.
Most of the province tipped that air quality chart yesterday, hitting 10 plus, the very high mark. Can you give us an idea of the scale that measurement is equivalent to?
Yeah, so we've started to try to translate these air quality advisories into things people understand, like how many cigarettes would it be like smoking? With air quality yesterday at about 10, if you were outside for around 2 hours, it'd be the equivalent of smoking a cigarette. And for those people who might have been working outside for, an 8-hour shift yesterday, that'd be the equivalent of 4 cigarettes smoked. So it is a significant impact on your health.
Interesting. All right. How dangerous is that to our health? I know you study the effects of air pollution on human health.
Yeah, so for people who have lung disease, so things like asthma, obstructive diseases, kids who are young, the elderly, even individuals who are pregnant, it's concerning. We know that people who have these diseases during wildfire smoke events or extreme levels of air pollution end up in the hospital more often. They need more medication. We see a rise in strokes and heart attacks. So even that short-term exposure is enough to make certain diseases worse. And we're trying to, in the labs, try to understand more what the smoke does long-term to individuals, even those who don't have, say, lung disease.
Are there any findings you can share with us? Are you seeing any results?
Yeah, so we know that even inhaling these small particulates, and I think that's kind of the key here, is to remember that wildfire smoke isn't just gas. There's these small little particles that are about 30 times smaller than the width of your hair. They get into your lung, start to damage the cells deep in your lung. They cause what we call inflammation. You'll get coughing, you'll get a lot of mucus. And the question we still don't know is long-term, does that lead to things like asthma? In children who are exposed to it, do they go on to develop asthma? So these are some of the questions we have, and the lab's just getting started up, and we hope to be able to answer those questions in the next couple of years.
Yeah, we are just at the start of wildfire season. We know last year was bad in terms of smoke. What is your advice to those watching? Our summers are short. It's really tempting to ignore warnings and continue with enjoying your activities outside. What's your advice?
It is, yeah. And you're right, last year was bad, and we have no indication that this year will not be as bad, or maybe even worse, unfortunately. So the best thing you can do is pay attention to the air quality advisories that are put out. And if you do have to go out, keep it for short bouts of time. Dust off that N95 mask, wear it. It'll help kind of reduce your particulate exposure. Stay inside in well-ventilated spaces, places that have central air, your house, the mall, and then, pay attention to your symptoms. And if you find that it's difficult to breathe, then it's probably time to get checked out and get yourself out of that environment.
Some great tips. Thanks so much for the insight, Chris. It was great speaking with you.
You too.